student ID is 369687, and this is for course ID UPT1 LJT1. This is my physical assessment. So today I have Ryan Cope here. He's my patient. Ryan, how old are you?
26.
Okay. And how much do you weigh?
185 pounds.
Okay. So I'm going to start by inspecting the skin, the hands, and nails. I'm looking for any deformities, discoloration, any abnormal patterns on the nail. The nails look pink, clean, well maintained. There's no problems there. Overall, his skin is warm, it's dry. There's no lesions, no bruising. Skin turgor. It's a quick return to original state. Everything looks good on the skin. Pretty unremarkable there. The next, I'm going to look at the head and the face. So I'm going to be looking at the scalp, the hair, the cranium. And I'm going to be looking at cranial nerve 7 here, which is symmetry of movement. So overall, the head looks normal. I don't see any bumps, nothing abnormal there. Let's see. I'm going to ask you, can you raise your eyebrows for me? Okay, can you smile? And stick out your tongue. Okay, everything looks symmetrical there. I'm going to palpate the temporal artery. And then I'm going to feel the temporomandibular joint here. Open your mouth for me. And close. Okay. Then I'm going to feel the sinuses to make sure they're not tender. Ryan, is this painful or tender?
No.
And what about here? These are the frontal sinuses.
No.
Okay, so no pain or tenderness there. Now we're going to look at the eyes. I'm going to test the visual field. So this is cranial nerve 2. So Ryan, I want you to cover your right eye. And I'm going to cover my right eye. Okay. And when you see my finger, just say when.
No. No. No.
Okay. Now we're going to move to the other eye, so you can change to the right eye. And we're going to do the same thing.
No. No. No.
Okay, very good. Now we're going to look at the extraocular muscles, which are cranial nerves 3, 4, and 6. We can do that by checking the corneal light reflex. So I'm going to shine the light in Ryan's eye and make sure that the white dot is on the same place in each eye. So you can just look forward at me. Okay, and that looks to be in the same spot in the eye, so that's good. I'm going to check the cardinal position of gaze. So Ryan, if you can just follow the tip of this pen light for me. Okay, very good. Then I'm going to look at the external structures. Have you had any drainage?
No.
Do you wear contacts or glasses?
No.
Okay. So I don't see any drainage. I'm looking at the conjunctiva, and it looks great. There's no redness or swelling. It's kind of pink and moist, intact. The pupils, I can check those by using my pen light. So Ryan, again, I just want you to look forward here. Okay, and both eyes are equal and reactive to light and accommodating. I'm going to look at the ears next. I'm going to feel the ears. Is there any pain or tenderness?
No.
Okay, ears look fine. I'm going to do a voice test. So I'm going to hold this over my face so Ryan can't see my mouth. Ryan, I'm going to whisper 3 letter number combinations. Just repeat back to me.
27F.
Okay, very good. And we'll try this one.
672.
Yes, perfect. Okay. So we got that down. Do you have any problems with your hearing?
No.
Okay. I'm going to look at the nose. The external nose looks good. Do you have any abnormal drainage or pain?
No.
Okay. I can even use my pen light to take a peek. You can just lift your head. Okay, and it looks moist and intact, so that's good. Okay. Next thing we're going to look at the mouth and throat. So I'm just going to take a look at the mouth. Open your mouth, please. We're going to look at the back of the uvula. Okay. Looks red, moist, intact, or pink. It doesn't look inflamed. Have you had any problems with your mouth at all?
No.
Eating okay?
Yep.
Okay. And I'm going to take a look at your teeth here. Okay. And you can lift up your tongue. Okay, everything looks good there. The palate, hard soft palate looks good. The tonsils look good. The uvula, which is cranial nerves, 9 and 10 look good. Any problem swallowing?
No.
Okay. And I already had you stick your tongue out, so it shows the tongue is symmetrical. Then I'm going to check the neck out. So I'm looking for the symmetry in the neck, which is nice and straight. Making sure there's no lumps or bumps, no visible pulsation, so we're free of all that. I'm going to feel the cervical lymph nodes, so I'll start here behind the ears. Any pain or tenderness with that?
No.
Okay. So then I'm going to look for the carotid pulse. He wouldn't be considered at risk for bruising. He's only 26 years old, but I can definitely feel the carotid pulse. And that feels strong. And then I'm going to hand you a glass of water. Go ahead and swallow for me. Okay, trachea looks midline, everything's good there. I'm going to stand behind him to feel his thyroid while you swallow. Okay. And there was no abnormal swelling or lumps or anything there either, so that looks great as well. Okay, now I'm going to have you do range of motion, so look forward for me. Good. And now look back. Good. Okay, now look to your left and your right. Great. Now do that. You're going to push against my hand, okay? Good. Now this side. Okay. Now we're going to look at the lungs. You can turn that away. So, the first thing I'm looking at when I look at the lungs is symmetry when you breathe. Take a deep breath. Okay, everything looks symmetrical. There's no additional use of accessory muscles. Everything looks to be intact. Go ahead and do it again. I don't feel any tactile phlebitis, so that's good. There's no lumps or tenderness. If you sit forward, Ryan, I'm also going to feel his spine. His spine is nice and straight all the way up. Okay. Now I'm going to listen over the lung fields. Deep breath. Okay. Okay. Now if you want to try facing that way, thank you. Now I'm going to listen to the back, the posterior lungs. I'm going to move in a side-to-side fashion so I can compare the lung sounds on the left and the right. Okay, lung sounds are clear. There's no abnormalities there. Do you have any pain with breathing? I don't feel any tactile phlebitis. I think that's good. So we looked at the anterior, we looked at the posterior. If you can face forward now, we're going to listen to the heart, the precordium. We're going to look for any pulsations. So I'm going to go ahead and lift your shirt up, Ryan. And I don't see any pulsations, I don't see anything abnormal. I can feel for the PMI, which you can feel right here. Okay. Now I'm going to listen to the heart sounds. So this is the aortic. Pulmonic, this is the apical, this is the tricuspid. Okay, I hear clear S1, S2. There's no murmurs, there's no clicks, no rubs. Everything sounds good there. Listen to the apical impulse. It sounds clear, strong. There's no trills. Rate is regular. Rhythms regular. Heart sounds are all okay. Okay. And I believe at the beginning of the assessment when we started, I did forget to get your vital signs. So that's something important that we'll have to get. So let's go back and do that now. I have to take your pulse, your respirations, and your blood pressure. So to take your blood pressure, I have a watch right here. that I'm going to use. Okay, so you had a pulse of, let's see, you were 17. So your pulse was 68, and your respirations were 20. So that's within normal limits. Your blood pressure, I don't have a cuff. What I would do is I would have the cuff on the patient's upper arm, align the indicated spot in his radial artery. I would take my stethoscope and place it close by there, listen, or blow the pump up to 240. And slowly release the valve and listen for the first sound, which is the S1, the systolic blood pressure, and then the second, which is the diastolic. And it sounds like a little thud, almost just like a little heartbeat, and then it'll kick in. So that's how I would take blood pressure. Okay. So we already went through the neck, anterior, posterior, chest, lungs. We've looked at the heart. We're going to look at the upper extremities. We're going to look at range of motion. Can you bring your arms up, down, make a fist, release? Okay. Now I want you to try to push against my arm. Good. Now pull, straighten your arm. Now pull back. Good. Same with the other one. Good. Good. That feels normal, strong, and intact. The epitrochlear node. So if I shake his hand and wrap my arm around, that's where I would feel those nodes in his arm. And if there was something wrong, they would be inflamed or enlarged. Otherwise, they're usually pretty hard to palpate. And I'm not feeling anything here, so that must be a good sign. We'll try with this one. And again, I don't feel anything there either, so that's a good sign. I'm going to also look at his neck vessels. I'm going to see if he has any jugular vein distension, which I don't see any. So that's good, although he is also sitting up. And next we'll be assessing the abdomen, and we'll have our patient lay down. Now we're going to do the abdominal assessment. So we have our patient laying down in a supine position. We're looking at contour symmetry, which is flat, it's not rounded or distended. The skin looks, colors consistent with ethnicity, it's warm, dry, there's no pulsations. I don't see anything abnormal in the abdomen. The first thing I'm going to do is listen for bowel sounds. So I'll start in the right lower quadrant. Okay, the bowel sounds are active and equal in all quadrants, so that's a good sign. Have you had any abdominal discomfort?
No.
Okay, and you've had normal bowel movements?
Yes.
Okay. Next I'm going to do some percussion on the abdomen. So we'll do over the stomach. Okay. Liver. Okay, so you can hear it there, kind of the border. Okay, so just a little bit of symphony there. Next we're going to palpate the liver, which is over here. Okay, and that feels normal. We're going to do a light palpation of the abdomen. Is there any pain with that?
No.
Okay, we're going to palpate for some organs here. The stomach, the spleen, the liver. Okay. We're going to check the femoral pulses next. Good. And on this side. Good. Okay, Ryan, I'm going to have you go ahead and swing around this way and go ahead and sit in this seat. I'm going to be looking at the lower extremities. So we're looking at the skin, which looks to be normal color. There's no bumps, there's no bruising, no rashes, no lesions, nothing abnormal. The temperature's warm and dry. There's no edema, no pretibial edema. We can check his pulses. Behind here is the tibial pulse, the posterior tibial. We can check that. Feels strong. The dorsalis pedis pulse. That's good as well. And on the other foot. Good. So again, lower extremity is pretty unremarkable. Next, we're going to move on to some musculoskeletal neuro. So that'll be our next task. We'll get our patient up and moving. The last thing we'll be doing is the musculoskeletal. So I'm just going to look over his ankles and his feet. They seem to be within normal limits. Ryan, can you point your toes down for me? Now up towards your head. Good. And your other one? And up towards your head. Good. Ankles look good. I'm going to check his sensation and make sure that he feels the same on left and right. Does that feel the same?
Mm-hmm.
Go ahead and close your eyes. Both?
Yep.
Okay.
Left. Right. Left. Left. Right. Both. 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 Both.
Okay, so his sensation is the same on both sides, so that's good. I'm going to check his position sense by having him jump on one leg. So Ryan, if you could get up. Just jump on one leg for me. Okay, good. Now the other one. Good. Okay, go ahead and have a seat. Now I'm going to place objects in Ryan's hand, and so he can identify them. This is known as stereognosis, so close your eyes.
Cotton ball.
Okay.
Spoon.
Okay. Now I'm going to test Ryan's cerebellar function. So touch your finger to your nose. Now to my finger. To your nose. Finger. Nose. Finger. Nose. Finger. Nose. Finger. Nose. Okay. Now we're going to test the heel to shin. So stand up. And take your heel and rub it right along your shin, up and down. Okay, now switch.